And other than that as well, it could be an occupation demand. So as I mentioned earlier, occupations that requires anyone to stand prolonged periods of time, or usage of a lot of their upper arms, especially those like, for example, in the construction industry, or even in like factories where they're required to bend down and look at installing equipments for a prolonged period of time. This also will actually contribute to having neck pain as well. And for example, those that are sitting in the office for long hours, for your clerks or your engineers or architects that are required, or even cashiers, for example, that are required to sit in front of a PC for long periods of time. Staying static in that motion for multiple hours over the day also will contribute to having neck pain as well. Okay. Lastly, will be overuse. This one, for example, will be if you are very active in sports. If you don't use it correctly, or the way you've been doing your sports, which is not accurate, it so can contribute to neck pain as well. All right, that will be more of muscular strain. So that means where any of these situation where you put excessive or extra demand on your muscles, where it will start causing all the muscles over your upper neck area, especially here or even the back of the neck, will start to be stiff at the same time and tight. Okay. Second common cause for neck pain will be physical injury. So anything from any form of accidents or trauma will actually cause neck pain as well. Accidents could be as simple as your motor vehicle accident, which if you are involved in any motorbike accident, for example, or any car accidents where the force, you had a sudden force over your neck, being put on over your neck area due to the seat belt, for example, or the impact of your head onto your airbags. This will cause neck pain as well. And lastly will be trauma. Trauma could be anything from, for example, you had a slip and fall at home, where you fall on the back of your neck, then your neck directly hits onto something or on the floor, for example, or maybe it could be maybe something fell over your neck area. So these are the examples of trauma, and could lead to neck pain as well. Other than that will be any form of degeneration or physical changes of your spine structures. I'm sure most of you at home would have heard of some form of terms, for example, like spondylosis or osteoarthritis, and also slip discs or things like that. These are could be clumped into this category of degeneration, or there's any physical changes of your spine structures. Do bear in mind that all of this as well not only applies to your neck, it could also happen to your lower back as well, but that would be another topic. But any degeneration or any physical changes over the spine could cause neck pain. So as you get older, or as your age increases, then yeah, there will be some form of degeneration over your spine, or if due to trauma as well, then it could cause some of the structures around your spine to be out of place, or it's not where it's supposed to be, then it will cause neck pain as well. But however, do remember as well, do not panic that degeneration also is common, and is a natural way of your body changes as well. So do not get too afraid by this, but it's just that certain types or forms of degeneration could cause neck pain. So that is very important to remember, not all degeneration. Other than that will be any abnormal growth around the spinal area. So this one will be a bit more rare, but at the same time, there's a possibility as well. Any form of growth, for example, could be like a tumor, or any abnormal growth of flesh or anything like that, any around the neck area could cause neck pain as well. And of course, lastly, do bear in mind that any heart or any other medical issues also as well could cause neck pain around, could cause symptoms like neck pain. So this one, it has to be remembered as well. So what do you do when you have neck pain? So if you see here would be first, most importantly, to get yourself assessed by a medical professional. So most of the time, orthopedic consultant will be able to give you a more accurate outcome or more accurate feedback on what could be the cause of your neck pain. If you're not sure or if you're unsure over what could be the cause of your neck pain, then yes, the first point or the first thing that you should do is get yourself assessed by a medical professional before you run into your own conclusion that what could be causing your neck pain, because we won't know what could be wrong inside or what could be the cause for your neck pain. After that is done, then most of the time the medical professional will either, if there's any, once the necessary assessment has been done, then they will advise you whether to do any tests or recommended tests to be done to rectify, to identify what's the issue of your problem for your neck pain. So commonly, what the tests are done would be MRI or any form of X-ray, and not to mention also any physical assessment would be done as well. Lastly, after the necessary assessment has been done, the medical consultant will either advise you to get necessary treatment. So what are the most common forms of treatment done would be physiotherapy, any forms of medications to help control the pain, and also if this one would be the more rare but also at the same time quite common would be your surgical intervention. So these are the three common treatments that the medical consultants suggest if to get treatment done for your neck pain. All right. So once we are done with just a basic introduction of neck pain, we just go through with everyone at home, how can exercises help with neck pain? We have to bear in mind that exercises are safe for neck pain. You don't have to worry that it will make it worse. A lot of people will have the perception that doing neck pain will make the situation worse, or it will break your neck, for example, or it will cause more sprain or more injury to the neck. All of these are actually quite common myths and prevent people from exercising with neck pain. But on the contrary, actually, exercise helps in reducing neck pain. So how can exercise help in neck pain? One would be reduce tightness over the muscles. Like I mentioned earlier, overuse of muscles or keeping in a very long usage of your muscles, for example, sitting in front of the TV or using a handphone or in the computer or laptop, all of these overuse will actually cause tightness over the muscles, which causes neck pain. So by doing exercises, you will reduce the tightness over the muscle, and that's how it helps to elevate the neck pain. Other than that, second point would be improve mobility or movement. This would be more beneficial in the elderly population where your joints mobility starts to reduce and you start to have problem with your movement. So with exercises, you help to improve mobility and also movement, and this will help in reducing the pain which is caused by stiffness as well. Other than that, third point will be when everything is all more flexible and loose over your neck region, then definitely it will help to reduce tension over the muscles and joints, thus creating more relief over the neck area. Okay. At the same time, by maintaining your muscle tightness, maintaining your muscle flexibility and your joint flexibility, and of course, then it will help to improve your posture. When your body is more flexible and is more loose, you feel more easier to move, and it's be more easier for you to keep your posture as well, the more accurate posture. All right. Not only that, it will help to reduce stress as well. Neck pain also at the same time is often associated with stress, and especially those migraine pain, or sometimes patients often comment of having headache-like symptoms. this type of pain is often associated with high blood pressure or as well with stress. Sometimes I'm sure some of y'all will have accounted where you are more stressful on that day, or you have more work at your office, you might feel your neck be more tight. So these are the common causes as well. And by doing exercises, we help to reduce the pressure over your neck. So you help to reduce that stressful feeling as well. And lastly, by doing exercises over your neck area, you have to create your body awareness. So this will be beneficial in you in correcting your position while you're at work. You know how to keep your body upright, or how to not keep that stooping position, looking down. So by doing exercises, it helps to create your body awareness. So when someone tells you, for example, or keep your body upright, or keep your neck straight, by doing exercises, this will help create more awareness over your body, so you know how to control your body better. Okay. So before we start the session on, for me to just teach you some very basic exercises to help in tackling your neck pain. There's a few reminders that I would like to highlight to everybody at home. Would be always seek a professional medical practitioner, should you feel unsure about your condition. So anybody at home that has long-standing neck issues, or if you're not very sure what could be the cause of your neck pain, if you're not sure about it, then I would suggest you to get a medical advice before you proceed. And the exercises that I'll be going through later may not be applicable for all. Exercises will change or vary according to patients. So the one that I'll be teaching later on will be very general, but at the same time, I am not sure whether it will be applicable for all. So but everybody is free to try, give it a go as well. Also a reminder that exercises that will be taught later are generally safe. However, if at any time while you're performing the exercises, if you feel any discomfort, or you feel not comfortable doing it, then please stop. Do not force yourself to do it. And as well, should you need any further clarification on suitability of exercises for your specific condition, do seek advice from a physiotherapist. Like I mentioned earlier, the exercises are very general, so it may or may not suit your condition. If you have an existing neck issue where you are quite sure that you may not be suitable for it, then do not perform the exercise later. All right, so that will be all. So we will start the exercises now. I will switch on the video so everybody can see me. I put full video. So correct. You can see it. Okay. Okay. So good morning. Good afternoon, everybody. So we start with the first exercise. Hope everybody can see me clearly. Okay. So the first exercise will be very easy. So I just need you to tilt your head sideways like this. So imagine that you want to bring your ear over to your shoulder. So if you're going down on the left side, okay, try to bring your left ear to your left shoulder without turning your head. So your head is constantly facing in front. All right. So once you go down, try to go down as much as you can. You'll feel some pulling sensation over on the opposite side of your shoulder. So try to hold in that position for 30 seconds. So you just count together 1 to 30. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay, so slowly bring it back to the center. Then after that, you can do it on your opposite side, whichever side that you've already done just now. So same, face, look in front, do not look down on the floor. Your face is always constantly looking forward. So when you go down, try to bring it as much as you can, then you feel a pulling sensation over this side. Then try to hold it for same 30 seconds. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Same, all right? So once you're done with both sides, after that, the next one you can do is just try to look down as much as you can. You'll feel a pulling sensation over the back of your neck, then hold for 20 seconds. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Very good. And look in front. Then after that, try to look up. So as you look up, just imagine you're looking up, then you want to feel some stretch over the front of your neck area. All right. And hold in that position for 20 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. All right. So that's the fourth exercise. Okay, the next one will be this one will be a bit different. Look 45 degrees to your either side, left side or right side, depends on you. Then after that, look down. So imagine you're looking down to your thigh. So you'll be going down at an angle. So same, count to 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Then look back in front. And same, you go to the opposite side at 45 degrees angle. Then you look down. Then you feel the stretch over at the back side of your neck again. Same, hold for 20 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Right? The next one will be more for your chest area. So try to just hold your hands together like this. Bring it at the back of your neck. Okay? So you start from this position. This will be a starting position. Put both your hands in front. Okay, now just try to open up your chest as much as you can. Okay, but do not use your hands to push your neck in front. Just to rest at the back. Okay, so once you open up, then count to 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. All right. Okay. Now will be the last exercise. Okay, this one I have to show it from the side. It's a bit different. So I hope everybody can see. So if you can see my chin over here, all right, I want everybody to try at home to try to bring their chin downwards like this. So it's like you're tucking your chin inwards. All right, so the movement is very little, it's not a lot. Okay, so just tuck it in and count to 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Okay. So those are the very basic exercises that everybody can perform at home. Not only at home, but you can do it in the office as well. Most of the recommendations would be try to do the exercises. You can do it very regular. Common recommendations would be if you can do it, let's say those are working in the office, they are always constantly in front of the laptop or PCs. You are the group of target population that we hope that you would perform your exercises regularly. Common recommendations would be each of the exercises that we go through just now, that we have gone through with you just now, try to do it around 2 to 3 repetitions per hour or every 2 hours if you can. It will take a while, not more than 2-3 minutes. But if you do this very regularly, every half an hour, every 2 hours or every hour, with just 3 repetitions of each exercise, it actually will help in a very big way if you do it very regular over the course of the day. Do bear in mind that our neck muscles and our joints and all are not really designed, or it's not meant to be staying in a static position for prolonged periods of time, to be staring in front of the PC or laptop. It will cause actually a lot of strain over your joints and muscle as well. So by doing these very simple exercises, it will actually help to reduce chances for having any neck issues. And also it will help to reduce that pressure, unnecessary pressure over your joints and muscles over the long course of the day while you're at work. Okay, so with that, then I would like to thank everybody for listening to the talk this afternoon, and hope to see you again soon. Bye-bye.
Thank you everyone for joining these sections, and thank you Mr. Jeffrey for the information, and everyone have a good day. Thank you.